Honest Truth
met Benita Vergatini. Smile 90.4 FM.
Joining us this evening to confront the rising crisis of substance abuse in pregnancy is member of the South African Society of Psychiatrists, Dr Bavi Vythilingum. Dr Vythilingum, good evening. Thank you so much for your time tonight.
Good evening. Thank you. And thank you for having us and allowing us to talk about this really important topic.
No, an absolute pleasure. So what are the drivers that contribute to substance abuse among pregnant women?
Well, I think generally there's been an increase in substance use among people, men and women in South Africa. In the last 10 years, it's really gone up dramatically, and we have rates higher than the rest of the world. But among pregnant women specifically, a lot of the things that drive substance use are other mental illnesses like depression and anxiety. So women are often using substances to medicate and to self-medicate the difficult feelings that they're having.
What are the dangers for mom and baby?
So, substance use in pregnancy really does pose quite significant dangers for mom and baby. One of the big risks is that the baby doesn't grow properly, what we call small for gestational age babies, where they're just too small for their age. There's risks of preterm labor, risks of high blood pressure in pregnancy. And then the big thing that everybody is really concerned about is, will the child develop normally? Will there be brain abnormalities? Will there be neurodevelopmental abnormalities in the children who are exposed to substances? And then when baby is born, a mother who's using substances is often finding it difficult to parent. So you have that problems or difficulties in the mother-baby relationship, and that again can lead to problems later on in the child's mental health and development.
What role does gender-based violence play in this regard, particularly around depression and anxiety?
It plays a very important role and quite a complex role. Women who are exposed to gender-based violence may use substances to medicate against the trauma that they've experienced. Often we see that partners who engage in gender-based violence are themselves using substances and put pressure on their pregnant female partners to then use substances with them. It's a complex and difficult thing to interact with.
Dr Bavi Vythilingum, member of the South African Society of Psychiatrists, joining us as we elaborating on the rising crisis of substance abuse in pregnancy. Share your thoughts on 0829 904 904. Many fear judgment when seeking help for substance abuse during pregnancy. Doctor, how can healthcare systems then create a more supportive environment for these women?
Well, I think the first thing is education, and that's something that our society's been doing for over 10 years now, educating other healthcare professionals and educating the public that substance use is actually an illness. It's a brain illness, and we shouldn't blame people for this. We should give them treatment. And also educating healthcare providers, and particularly in the case of pregnant women, maternal healthcare providers, that they need to support women and that they need to help them in their journey and work with mental health care services to get them off their substances.
And when you say treatment, what does treatment look like? Are there a range of approaches that professionals can apply?
So it really depends on the individual person, and we try and create individual packages for that person. So treatment could range from counseling, it could range from counseling programs, it could range from step programs like NA and other 12-step programs. And sometimes we do inpatient-based rehab programs for people who maybe prefer that, or others who have struggled with managing on their own in the community and feel they need more support.
There have been some rather drastic interventions being put forward, like removing a newborn from a mother due to substance abuse. Is something like that considered?
It's not something that we would routinely support. We try and keep mother and baby together as much as possible. And the only time that a newborn should be removed is if the newborn is in danger. So that would be the criteria. But for the vast majority of women using substances, their newborn is not in danger. You know, women who use substances, in our experience, really want to get off their substances. They care for their babies. They know that what they're doing is harmful, and they desperately want help. And our role is there to give them as much help as we can.
Around that help, would harm reduction strategies also play a role in treating women with substance abuse?
Absolutely. Harm reduction is one of the key principles in substance use treatment, and it's something that we would support. I mean, our goal clearly in pregnancy is abstinence,
yes,
but we would go for what the best outcome is for that mother and baby pair.
Does intergenerational trauma also play a role in contributing to substance abuse amongst women who are pregnant, Doctor?
I'm so glad you asked that question, because it's something that we see all the time. You know, so often you sit with a woman who's pregnant, and then her mother is in the consultation, and you start talking about trauma and depression, and the grandmother of the unborn child starts crying and saying, but I had this when I was pregnant, and I use substances to try and help me. So you have a child that grows up in an environment where substances are used to help them, and that's what they learn. So a huge driver for treating pregnant women is to break that intergenerational cycle.
And how can that cycle be broken? Can it be broken effectively?
Oh, I really do believe so. I mean, we see this all the time with women that we treat. There is a patient that I treated more than 20 years ago who is still clean and still sends me a text message every year on her daughter's birthday to say we're doing well. I mean, and you know, she was really, really ill. And that for me just speaks to the fact that if you're there and you're treating and both of you put in the effort, you can have great outcomes.
Lastly, Doctor, how can family and communities also provide support to pregnant women who are struggling with substance use?
I think the first thing is by not judging, by recognizing that this is somebody who needs help and may have other mental health problems, and to go with them to the clinic, speak to the community sister, speak to the psychiatric sister, find out where help is available and support them, be it emotionally, financially, in whatever way they can, to help them get the help they need.
Member of the South African Society of Psychiatrists, Dr. Bavi Vythilingum. Appreciate your time and insights, Doctor. Thank you for joining us tonight.
Well, thank you very much.